Welcome to the Dr. America Show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram. Thanks so much for joining us for today. It's a really special episode. We are broadcasting this on Mother's Day. So to all the moms out there, happy Mother's Day. And this episode is all for you and all the wonderful things that you do for us kids. And to recognize the importance of Mother's Day, I was honored to be invited by the group called Save the Children to MC a really special event that they had today. Actually, we're recording this on Tuesday, May 5th, and they had a really important event today to launch a report on the state of the world's mothers. And this is a really special report that Save the Children does every year. And this year, I have a copy of the report right here, and they call it, it's the state of the world's mothers. And this year, they decided to focus on the urban disadvantage. And what they mean by that is that worldwide, our population has been shifting towards living in cities, growing in cities. And so a lot of the health problems and a lot of the health challenges that we face are now happening in city environments. And what's really interesting about that, and I know that this might sound like kind of a depressing topic for Mother's Day, but I actually want to assure you guys that there's a lot of reasons to be optimistic, and the report does a lot of great stuff about sort of showing, how far we have come. Because when you consider that today, in 2015, 17,000 fewer children every day, 17,000 fewer are dying every day because of the work being done by people in medicine and public health. And, that number is compared to where we were, back in 1990. So 17,000 fewer children dying every day is a big deal. And then when you look at the number of children who are dying under the age of 5, we have cut that mortality rate in half since 1990. So, just in 25 years, we've done an incredible amount of work for kids, for moms. We're doing a whole lot better by these families, and I'm really excited to be a part of Save the Children's launch for their State of the World's Mothers report. So, this episode, actually, we're going to take you guys to the launch event, and we got to film that earlier today. So, I'm really excited to introduce you guys to the panel. We're going to get to meet some amazing doctors, because the reason why they had the panel here in Washington, D.C. is that they found that when they looked at Washington, D.C. and compared that, like this is our nation's capital, and they compared it to the capitals of other wealthy nations, and out of 25 wealthy nations, Washington, D.C. has the worst infant mortality rate out of all 25 of the countries that they compared it to. So it's kind of a dire picture. And what's even worse is that when you look in Washington, D.C., it does make a difference whether that baby was born, in Ward 8, which is like the southeast side of D.C., just south of the river, or if they were born in, the northwest side of D.C. in Ward 3. If you were born in Ward 8, you have a 10 times higher risk of dying as a baby than if you were born in Ward 3. So, Save the Children wanted to, they didn't want to just like push out a report and then not ask like the important questions. And so it was a great opportunity to cover how far DC has come, how much further we have to go, and why that is. So it was a really great discussion. I'm really excited to share it with you guys. And so, I'm going to cut to that program, and you'll see me back over with Save the Children, the ARC, Children's National Health System, and the DC Department of Health. So enjoy. Good morning, everyone. My name is Dr. Sanjeev Sriram, and I am the host of Dr. America for the WEAC Radio Network, and I am also a pediatrician here in Ward 8 of Washington, D.C. So today, Save the Children has its annual report, The State of the World's Mothers, and we have a lot to learn about how mothers and newborns are struggling worldwide, including right here in Washington, D.C. And when you look at like the 25 wealthiest capitals in the world, so these are the capital cities of the wealthiest countries in the world, Washington, D.C. has the highest infant mortality rate of them all. And what's even more concerning is that when you really zoom in on Washington, D.C., what you find is that which ward a child lives in starts to determine what risks they're being exposed to and what outcomes they could be looking at. And so, to help us make better sense of this picture and to get an understanding of how we got here and better yet where we could be going, I'm really pleased to team up with Save the Children, who have convened an all-star lineup of advocates and physicians. We have Dr. Kurt Newman, who is CEO of Children's National Health System. We have Dr. Marseille White, Medical Director of the ARC right here in Ward 8. And we have Dr. Gingy Lindsay, Deputy Director of Programs at the DC Department of Health. Now, as we hear from Dr. Bina Valsankar and this entire panel, what I'm really hoping is that we can hear the information and translate it into action. Because, just like G.I. Joe said, knowing is half the battle, but our children are depending on 100% of our efforts. So with that, I'm going to hand it over to Dr. Valsankar, Technical Advisor for Save the Children.
Thank you, Dr. America. Thank you, everyone, for joining us this morning. My name is Bina Valsankar, and I'm with Save the Children. Every year around Mother's Day, Save the Children issues an annual report to put the spotlight on moms and their critical role in their children's health and well-being. Released today, this year's report, which is titled State of the World's Mothers 2015, The Urban Disadvantage, focuses on the health challenges for mothers and young children in the poorest neighborhoods and biggest cities around the world. The report also offers an annual review of the best and worst places in the world to be a mother. So why are we focusing on cities this year? Because, for the first time in history, more than half of the world's population is living in urban centers. Moms are raising their children in urban areas in larger numbers than ever before. While a majority of families benefit from the many advantages of urban life, the poorest among them are often left behind. In fact, as our report shows, one of the worst places in the world to be a mother is an urban slum. Within the next few years, 1 billion of the world's population will live in slums, where millions of women and children are left behind by the extraordinary economic progress of our time. The plight of impoverished mothers and children is largely invisible and often neglected in big cities. And average statistics for urban health measures, such as average infant mortality rates, can mask the suffering that is taking place in our poorest neighborhoods. Our speakers today on our panel will explore with you the causes of infant mortality in the District of Columbia and the many programs that are now underway to address this issue. The story of the rates at which babies are dying in Washington, D.C. is a tale of two cities. It illustrates the huge survival divide between rich and poor children common in many other cities around the world. On the one hand, there's Ward 3. The district's wealthiest has one of the lowest mortality rates comparative to cities like Tokyo and Stockholm. In contrast, there's Ward 8, the city's poorest area. In 2012, the infant death rate in Ward 8 was 10 times the rate of the infant mortality rate in Ward 3. To its credit, the District of Columbia has made important progress in saving the lives of babies. Over the last 15 years, D.C. has cut its infant mortality rate by more than half. Despite this, babies are dying at much higher rates in our capital than other cities' wealthy capitals. A Save the Children survey of 25 capitals in wealthy nations found that the District of Columbia had the highest infant mortality rate. More importantly, the infant death rate in the city's poorest wards, especially Ward 8, have remained stubbornly high, much higher than the citywide average, and this disparity between the survival of babies Ward 8 and Ward 3 is significant. We need to work harder to diminish the infant survival divide across Washington, D.C., just as we need to work harder to close the gaps in the cities around the world. Save the Children's report has identified huge child survival gaps in cities across the developing world as well. In over 2/3 of developing countries with available data, the poorest children in urban cities are at least twice as likely to die as the richest children in the very same cities. Impoverished mothers face a harrowing reality. For babies in the big city, it's survival of the richest. In Washington, D.C., we found that declining child mortality averages often hide huge gaps in the rates at which poor children are dying compared to the rich. Today, we're here to call on local, national, and world leaders to act now to focus on increased attention on the plight of the urban poor, and especially on closing the urban health divide that separates rich and poor families. With more and more moms living in cities, the survival of their children should not be a luxury of the rich, but something that's guaranteed for all. As you all can probably see, I'm expecting a baby myself within the next month or so. And I worry about finding daycare, I worry about balancing family and work, but I don't worry about losing my life or losing the life of my baby around the time of birth. And we're all here today to make sure that that is the case for mothers in Ward 8, mothers in DC, and mothers all around the world. Thank you very much.
Good morning and welcome. I'm Dr. Marce White, Medical Director of the Children's Health Center here at the ARC and Mobile Health Programs here in Ward 8. This is one of my favorite pictures, my son and I, Jaden. About 6 years ago, when I was expecting, my doctor told me to eat healthy, well-balanced meals, exercise, see my dentist to get my teeth clean, and also to make sure that I decreased the stress in my life while I was caring for my child. I love this picture because you'll see that there's a huge similarity between my picture with my son and my mother and I. Because I'm sure over 35 years ago, her doctor told her to do the same thing. Eat healthy, well-balanced meals, exercise, and to do the things as mothers were instructed to do to ensure that we deliver a healthy newborn into this world. However, for some mothers, realizing these goals is challenging. Some mothers do not have access to groceries that have healthy fruits and vegetables that they can nourish themselves so they can nourish their young. Some mothers do not have adequate, affordable housing so they can make sure that the homes are safe for them to bring their newborn infants into. And unfortunately, some mothers do not have the proper wages for the jobs that they hold in order to make sure that they can keep the lights on in their homes and also keep enough food on the table to sustain them for the rest of the month. Maslow's hierarchy of needs shows us that we have to make sure that the fundamental basic needs of every human being are met before we can realize self-actualization and achieve one's greatest potential. The work I do as a pediatrician here in Ward 8 is making sure that the mothers of these infants, when they're delivered, that they have the support that they need to ensure that they can meet the most basic needs of their families. Making sure there's food on the table, making sure there's adequate housing, to decrease the stress and the toxic barriers that our families can experience. This is fundamental to every mother who wants to give birth to a healthy newborn. As a pediatrician, it's important to do more than just give vaccines, prescribe medication. It's important to address what we call the social determinants of health, making sure that we look at the economic factors, how poverty, how education, how housing, and the inequalities, as we discussed with infant mortality, affect the families that we serve. Soon in July, in partnership with DC Greens in Arcadia, we will launch the Wholesome Wave Fruit and Vegetable Prescription Program so that we will ensure that kids who are coming into our group visits get prescriptions for healthy fruits and vegetables to make sure that those fundamental needs are met for the families that we serve, to help the women that come in with their infants to make sure that there's enough food on the table to sustain their families for the remainder of the month. These things are fundamental. These things are what we, in collaborations with other community partners, need to do in order to ensure the health and well-being of our Ward 8 community. Thank you very much.
Thank you, Dr. White. Our next speaker is Dr. Gingy Lindsay. She is the Deputy Director of Programs of the DC Department of Health.
Thank you and good morning. On behalf of the DC Department of Health, Director Dr. LaQuandra Nesbitt, I thank you for allowing us to participate in today's event. What I plan to speak about over the next few minutes is just a brief overview of some of our infant mortality data with a preview of some of our 2013 data, which is soon to be officially released, as well as an overview of some of our strategies in addressing infant mortality. And so what I would like to say to save the State of the World's Mothers report does highlight our 2012 data, and you did see there a slight uptick to 7.9 deaths per 1,000 live births. In 2013, we had 63 infant deaths in DC, giving us a historic low infant mortality rate of 6.8. That's about a 30% decline since 2009, and what I am pleased to say, I always want to emphasize that we have to interpret the data with extreme caution because we have a relatively small sample size in DC. We have less than 10,000 births a year. And so when you see some of these fluctuations from year to year, it's not always because we did something well or we didn't do something so well. Some of it is just normal standard deviation. But what is positive and what is promising is that we have had a steady downward trend since 2007. We have also seen a decrease among the mortality rate for our Black mothers, a rate of 9.9 in 2013, and in 2013, which is almost half of that of 2005 rate of 18.4, which is just unacceptable. The Healthy People 2020 goal is to reach an infant mortality rate of less than 6 deaths per 1,000 live births. And this here just illustrates some of the trends over the last 5 years, and that's broken down by ward. And so you can see there are some minor fluctuations from year to year in each of the wards, with Ward 3 having some of the best outcomes historically. What is interesting for 2013 is that Ward 8, the infant mortality rate has actually decreased to 10.9 per 1,000 live births. And we see now that Ward 5 has the highest rate of 11.9 deaths per birth. And while we have seen decreases among the infant mortality among our African American or Black mothers, there is a persistent significant disparity between Black and white. So what is causing this? Lots of things. But one thing we do want to emphasize is that in the district, which is unique to some of the other urban cities or some of the other states within the U.S. is that our leading cause of infant mortality is maternal complications. It's not congenital malformations. It's not sleep practices. It is maternal complications. So I highlight some of those factors that almost half of our infant deaths were to mothers who were either obese or overweight. 71% of those deaths occurred during the neonatal period, so that's infants less than 28 days old, and 81% of our infant deaths are from preterm deliveries. And this is important because we know many of these things can be mitigated or prevented. Looking at some of the statistics breaking down, so what we're looking at here is pre-pregnancy weight by race and ethnicity. That's averaged from 2011 to 2013. The majority of white mothers are entering their pregnancy at a healthy, normal BMI. The majority of our Black and our Hispanic mothers are entering pregnancy either obese or overweight. There is a big difference in access to first trimester prenatal care. In Ward 3, in the darker shaded area, you'll see that over 80% of mothers are entering prenatal care in their first trimester. When you look over to see somewhere between 50 to 60% of women entering care in the first trimester, that's going to be Ward 8, Ward 7, and Ward 5, where we have our highest rates of infant mortality. What I think is great about this report is that there's really an emphasis on poverty. What we see again and again and again is that poverty has an enormous influence on health outcomes. And so what we can look here on your right, my left, is the percent of people living in poverty by census tract. And so as the green gets darker, that's larger percentages of people in poverty. You can overlay that map right onto rates of infant mortality. And I could do this again and again with almost any health metric. We could do this for homicide, heart disease, lack of educational attainment. The list goes on. And so what's very important that we, Department of Health, has always recognized that there are significant disparities, and they are very closely linked to the social and economic factors, with poverty being one of the main ones. And so what are we going to do about it? Good question. One of the emphases that we have moving forward is that we want to achieve health equity. And what does that mean? That means that we want to have the highest level of health for our entire population. We don't want to just make sure that we've taken care of disparities. That's one thing, and that does need to be addressed, and that falls under the umbrella of achieving health equity. But we want to make sure everyone has the highest outcome. What's important is that we need to really understand what are the major factors that are influencing health, and about 40% of that is going to be influenced by socioeconomic factors, where maybe 20% of that is going to be influenced by clinical interventions. So not to diminish clinical interventions, they're very important, and all of these, every level of the pyramid needs to be addressed, but what we really need to focus our efforts is addressing those social determinants of health and looking at systems level interventions like policies, like environments. How can we change this so that our population is healthy? Social determinants of health are basically the circumstances of which people born, live, work, play, and age. And so when we talk about Ward 8, there's people are born into probably poorer households. There's higher percentage of single mothers. There's less access to healthy foods. And so that's going to have a significant impact on their health. And what shapes these social determinants of health are social policies, politics, and economics. Another important term that I like to talk about, and Dr. White touched on, is the concept of life course, that we understand that every stage of life is going to influence the next. And so if Dr. White was stressed during her pregnancy, that's going to have adverse impact on her child and her child's long-term health. And so we've seen numerous information about adverse childhood experiences, so those children that have had higher levels of hunger, haven't had access to good education, and as these experiences accumulate, we can tell you that you're going to have poorer health outcomes down the line. You're going to be more likely to have chronic disease and to have a premature death. When we talk about systems level intervention, there's a few sides of this. One is just that we need to coordinate well among our public health and our healthcare system, and there we have lots of partnerships between the District Department of Health as well as Children's National Medical represented here today, and many of our other healthcare partners. I do also want to point out it's a commitment for our new administration under Mayor Bowser that we're looking at health in all policies. We understand that when you make a decision on where a supermarket is going to be built, when you make a decision on who's going to have a playground, where are sidewalks, those are all going to influence our residents and our population's health. At the same time, we also need to look very systematically at what data are we collecting, what are we measuring, how can we understand these issues better? And we have to do this across the board. I can't just look at my 500 people and make a broad determination for the district, but we need to across the board. We all need to be very cognizant that we need to have some shared measurements so that we can better inform our policies and practices in addressing these complex issues. Lastly, I just want to touch on the concept of collective impact. I think what's been the standard and historically has been what's been more of an isolated impact, that we get funding from Bill and Melinda Gates to purchase safe sleepers, and we put these sleepers out and we hope that no babies die from SIDS or SUIDs. But what we really, and that's great, but what we have seen, and you can look across not just health but other social sectors, that you invest these millions and millions of dollars, but it's not well coordinated. So Bill and Melinda are doing this, DC Department of Health is doing this, Children's is doing this, and although we all want the same thing, we're not coordinating very well together. And so what we really want to emphasize moving forward is collective impact. You hear a lot also about public-private partnerships, and that's very important. But we need to do more than leverage our financial resources. We have to well coordinate our efforts. And so some of those key features that we're looking at addressing through infant mortality is that we have a common agenda. And so not just DC Department of Health and Children's wants to see infant mortality, but that the housing sector wants to see infant mortality go down, that Walmart wants to see infant mortality go down. that we're sharing our measures, as I mentioned before, that our activities are mutually reinforcing. So we don't all have to do the same thing, but it has to be supportive and aligned, that we're continuously communicating with each other, that we're in touch with our stakeholders, with a very important emphasis on our community members being part of those stakeholders, and that there is an organization that will be the backbone and support. And I do also just want to emphasize as well, when we are talking about social determinants of health and achieving greater equity, very important to that is economic achievement. And under the Mayor Bowser, we are committed to Pathways for a Middle Class, and that's achieving better economic status, which in turn is going to achieve better health status, and that's a continuum that goes on and on. So I hope that was brief enough, and thank you for your time.
Okay, and our final speaker on this morning's panel is Dr. Kurt Newman. He is CEO of Children's National Health System here in D.C.
Well, thank you, and good morning, and thank you for the introduction. However, I wasn't always a hospital CEO. Most of my career, I was a pediatric surgeon, so I saw this problem from a different aspect. I saw the babies that were born that maybe were very premature and had problems, and we would do all we could to save their lives, but sometimes that wasn't possible. And that perspective has informed my thinking and approach as I'm leading our health system to really think more like what you've heard here from Save the Children, from Dr. Lindsay, Dr. White, to think more upstream. We can't be reactive. We have to be thinking about what are the problems, what are the factors that lead to these statistics. And they are statistics, and there's great progress. And I really think we ought to, as was said, not make light of that. There's still big challenges, and we see these maps and the differences, the disparities, and the work we need to do. But I think there's some optimism that we can make a difference. And I think we've heard some of the ways that we can all pull together to make a difference. And that's what Children's National is all about. That's what all the doctors here are about. The Department of Health is to make that difference, to find the problems, find solution, and then find solutions where we can come together to do that. So what are we doing? I mean, we've got these issues. We're here in the what I think is the greatest capital in the world. We identify the problem, but there are solutions. For example, we're spearheading a program called Healthy Generations that's located at our main campus on Michigan Avenue, but also in some of our ambulatory locations here in Ward 8 on Good Hope Road, Martin Luther King Avenue. And it's a comprehensive, it's family-centered, multidisciplinary program which builds teams and gets these teenage parents and their mothers and dads, and being a dad, I want to focus that. We talk a lot about the mothers, but there's a big responsibility here to the dads on things like we've heard about that are straightforward, but we get access to these young people and teach them about healthy eating and the lifestyle habits and the importance of pre- and postnatal care, because they're young and they may not have ever thought about that. So we're not only providing the safe prenatal care at that time, but we're trying to influence the lifestyle decisions that these kids will make as they then are parents. In addition, we talk a lot about advocacy, and we're working across the nation. 7,200 kids are born with congenital heart disease. And if, there's a number here in the district, so that's when the hearts aren't formed properly. Well, we can identify those problems early with simple testing. So we're working on legislation across the country so that every baby before they go home from the hospital will have a test to make sure that they don't have congenital heart disease, because that's something we can fix. And we're doing it's legislation called the Healthy Heart Act, and we're working on it right here in the district. So that's an example of another approach, advocacy, where we can do things to improve the health of babies. Collaborations, and I loved the way Dr. Lindsay talked about that, because I've always been about finding partnerships. We can't do this work alone. We've got to find the partners that we can work with, and we've got multiple examples of that in the city. We're working with the public schools, daycare centers, throughout the community to offer education and access to programs for particularly teen parents, because they're in our schools and they're with these programs. We're very proud of the Mental Health Collaborative. Well, you're thinking, well, what does that have to do with infant mortality? Well, there's this wonderful collaborative for mental health in pediatric primary care. I was talking with Dr. Lindsay about that before, that brings together, we work with particularly the Mary Center in Georgetown on this, and it's around looking at the mother's moods and anxiety, because we all know there's postpartum depression. There are all these factors that can influence how babies are cared for. So we need to screen for that and then tackle that, because that can make a difference. So there's all these different aspects that can come together, and if we're trying to do something alone, we're going to miss something, and we're going to be focused on a narrow area. So it's important to have these collaborations, whether it's the Community of Hope, whether it's the Children's Law Center. These organizations, we can do a lot of great work together. So what's the call to action? It really is true that healthy babies come from healthy mothers, and each of us has a responsibility to work on that in our own way, in our community, before women get pregnant, to be sure that once they become pregnant, they get the best care and support. So we want to partner to work on these issues with community-based programs. We want to make sure every baby and mother has a medical home, a place that they know that they can get the help that they need. And we want to encourage mothers and pregnant moms to be healthy and do all the things that Dr. White talked about when she found out that she was pregnant, to reduce that stress, to eat healthy, and to really focus on the best outcomes with the best prenatal and postnatal guidelines that physicians and advocates are providing. I'm proud to be a doctor here in Washington. I'm proud to be a part of a health system like Children's. I'm proud to have a partner like the Department of Health. And I'm proud to be working with an organization like Save the Children. Because when you see us all come together like that, there's no problem that we can't solve together. And I know we'll solve this one. Thank you very much.
So we have time for a few questions. Maps that have been presented, Ward 5 is showing some problem areas just as much as Ward 8, and sometimes maybe even worse than Ward 8, and whether the Department of Health had thoughts or perspectives on why that is and what could be done about it.
So Ward 5 has had a historically high infant mortality rate. It's actually just about 2% higher in 2013 than 2012. And so I think all of those factors that you mentioned definitely are what's influencing this. It's lack of financial resources, lack of educational attainment, lack of stable housing. I mean, these issues that we have in Ward 5, we also have in Ward 7 and Ward 8. And so the fluctuations you'll see in terms of who's the worst, that's a horrible competition to have, but they have had historically high rates across the board for Ward 5. It's just that what we have seen for 2013 is a pretty significant decrease for Ward 8. It's about 25% or so lower than what it was for 2012. So I think important to recognize that this is data from 2013, and we have definitely seen a lot of those economic changes in DC in the last several years. 2013 might be lagging a bit behind on what we're actually seeing in 2015. It is, I think, very important to emphasize that there are going to be disparities even within the wards, and you cannot, time and time again, almost break this down over and over again to these social determinants. And so where you have households that have worsening risk factors or worsening social determinants of health, you're going to have worse health outcomes. We've historically focused on lots of efforts in our wards that we know are more disparate. Dr. White mentioned the wholesome food wave. I mean, that's some of that is supported by the Department of Health, and we definitely target our areas, our neighborhoods we know are more disparate. We have the maternal infant early childhood home visiting program that has targeted wards 5, 7, and 8 because we know those have worse incomes, and that's looking at enhancing parental resiliency, greater economic opportunity for families, and preschool or school readiness for our children. Again, because there's very close links to educational attainment and long-term health outcomes. And so most of our programs that we've had in the District Department of Health, we have always focused on those wards that have poorer health outcomes.
In Dr. Lindsay's presentation, there was some pretty stark contrasts for families that had smokers and families that were dealing with obesity, and whether Dr. Lindsay had additional perspectives on those contrasts.
I think important to recognize that these are closely linked with some of the more adverse social determinants of health. I hate to keep using that phrase, but it best sums up kind of the gamut of things that are adverse things that are affecting our family. So when you're looking at overall health, you do see higher rates of obesity in our more unhealthy wards, and we have seen a pretty good link of obesity with higher chance of having infant death. Again, I'll also link this back to Dr. White's comments on toxic stress. The Adverse Childhood Experience study came out of a doctor who was looking into what was causing obesity, and childhood trauma was linked to higher rates of obesity. And so what we need to start talking about is not just focusing on women during the prenatal period, but how can we make all of our women of reproductive age healthier? Where does that start? And it starts before birth. We have to make sure that that the mothers are healthy, that children grow up in healthy neighborhoods, healthy environments, and can achieve their optimal health.
I just wanted to piggyback on Dr. Lindsay's comments and just sort of provide a story just to give an illustration of some of these toxic stressors that our families are dealing with. Just recently, one of our providers encountered a mother who has about 9 kids, and about 3 of her kids have asthma. And the provider asked the mother, has she quit smoking yet? And the mother said no. And she had time to ask the mother additional questions about why she smoked, to really get a better understanding of what her social circumstances were as far as why she felt the need to smoke, knowing that this put her children at risk. And her comment to our provider was, "Doc, I know that this is unhealthy for me, and I know it's unhealthy for my kids to be around me when I smoke, but it's the one time where they do not bother me, where I have time alone to myself, and that's why I smoke that cigarette." And it provided that provider, that pediatrician, an insight into the other social support that this mother needed in order to stop smoking. She understood very clearly what clinical impact, what health impact this had on her kid. But this mother was telling us that she needed respite, and she was getting her own respite by smoking 1 cigarette a day. So we have to ask the right questions to make sure we understand the full breadth of what the problems are, so that we can provide adequate solutions. Because just telling this mother you have to stop smoking is not good for your kids, they're asthmatic, without providing her some social support for her to get that respite wouldn't help her. So it's really about making sure we understand the full story.
And I'd like to actually ask a question to you, Dr. White, about that sort of piggybacks off of that, and that is that as healthcare providers, whether we're from the time that we're medical students in training throughout residency and onwards, many of our interventions have this focus on the biomedical paradigm and that clinical intervention and technology. So how do we include and sort of recalibrate so that we're addressing social determinants of health when we're face-to-face with patients?
So, to my earlier comment, I think it's about asking the right questions and making sure that we're not afraid to deal with the answers and provide solutions and opportunities for our families. Here in the audience today, we actually have some of our residents and our pediatric residents, doctors in training. And at Children's National Health System, we have a track, a community health track that is dedicated to training residents on how to make sure that they ask the right questions, how to ask a family, do they have enough food to last them towards the end of the month, how to ask a family, what are their employment status, do they need help getting educational attainment, do they need vouchers for child care, do they need vouchers for WIC, how can we assist them in doing that. The other thing that we've done is we've integrated services, these social services within our medical homes so that we can reduce the transportation barrier that families experience, not only accessing health care, but accessing services to support them. So I think fundamentally, us as providers, we have to make sure that we're asking the right questions to make sure that we're addressing the social determinants of health and utilizing the resources that do exist. There are many community organizations, many other groups that we collaborate with to address these. Dr. Newman mentioned the Children's Law Center, which is one of our great collaborators with our medical legal partnership, so that when we identify families that need additional assistance, we can make that referral to the Children's Law Center to help them do that. But first, we have to ask the questions to make sure that the families need that service.
And that actually leads me to my next question, and this one's for Dr. Newman, about those collaborations, because like even this morning, we've got like kind of an Avengers thing going on where we're collaborating. You got Dr. America, and I'll let you guys figure out who wants to be Hulk and Thor and, Iron Man. But when it comes to, team recruitment, like who are the teammates that we need to recruit, and what are the powers that we would like to see them deploy on issues like infant mortality?
Well, thank you. And it's hard to answer while I'm spinning, thinking which one of those. Being a hospital CEO, I could probably use those powers in lots of different dimensions. But it's a tremendous question. I think back to the question, though, that I thought was very insightful that the questioner asked about Ward 5. And, when you think about it, to have data that you can trend and look at almost real time about where vulnerabilities are, where we need to target resources, who do we need to bring together, and that Dr. Lindsay can pinpoint some of the areas, and maybe it's a lack of access to healthcare, and we can analyze that, or we can look at some of these precursors, whether it's obesity in the mothers or not, and then bring in the right partnerships. And for example, Ward 5, it might be the partners there. You would want to look at the community organizations that are already there, that are on the ground, that are whether it's hunger or the medicine side of it, or the mental health side, and build those coalitions. Look at the schools. We're making tremendous progress with school health, and there's great examples of that. You could look at some non-traditional ways of maybe serving, maybe it's mobile health. When you look at where we are right now, this is just a wonderful symbolic example of how different organizations can come together in a part of the city that nobody would have thought was possible around medicine, art, music, education, and leverage and catalyze those resources. And then I think at the heart of it, we've got some great convening forces in the city, the Department of Health. And they're forward thinking, and you just heard in that summary about how all the way through every piece of legislation, everything we're doing, we need to be thinking about health. I don't know that any other city's thinking or talking that way. So that it's fertile ground for organizations to collaborate, not compete. Really develop the vision, think local, think what's there, use data, and it's exciting work. And you get these. Dr. White mentioned. I mean, the idealism of young people, and that want to make a difference, that want to volunteer in this city is it's exploding. So it's up to us to figure out the right partnerships, whether it's mentoring, whether it's providing more services in part of the city that need it, whatever it is to guide those solutions.
How do we make the deficiencies of our social determinants of health more readily available to parents so that they're not having to hop around from one place to another to get the various kinds of help that they need, and how do we turn it into a one-stop shop model?
It would be great if we can have, everything co-located as much as possible. We know that that's challenges as far as resources, but certainly having individuals with the expertise about what resources are out there. As you mentioned in your comment, there are many resources, there are many partners and experts that are doing this work, and we can leverage their expertise and their finances and resources to help us address the needs of our families. But I think it's the care coordination piece that's needed. An entity within the medical home that has the awareness, that has the connections to these programs and resources, that we can then allow that person to develop a rapport with the family, to spend time to really get an understanding of what their needs are. So someone, a social worker, a care coordinator, a parent navigator, someone within the medical home that can link families to the resources that might not be co-located. We've been fortunate here at the Children's Health Center at the ARC to have some grant support to co-locate some services, but certainly those that aren't co-located with us, we have experts within our clinical setting that can refer our families out to those resources.
I completely understand your plight. I've been practicing in the district since about 2007 and thought I was pretty well versed on what resources were out there. And I started the Department of Health, and I'm like, oh, we have this, oh, we have that, wait, they do that, and this goes on over here. And it is, it's daunting to look at everything that happens in the city, and how can we best coordinate that. One project I'm very excited about that we are in the early planning stages, hopefully moving to implementation in the fall, is the establishment of what's called Help Me Grow. And this is a national model that helps to coordinate, basically coordinating referrals for early intervention to decrease developmental delays and disabilities, or at least to well address them. So it's a one stop. You call, you don't know what to do, a provider doesn't know what to do with their child, or a parent doesn't know what to do with their child, and we can get you referred into resources that are going to be helpful. What my dream is that this can then be expanded out and can just be a resource referral line for our moms and families in the district. Because yes, there does need to be a great effort to get all of these efforts coordinated and accessible for providers and for residents to use.
To follow up, I think Dr. Lindsay's onto something there, and through the community health needs assessment, the community health improvement plan, where the community is asked what are the needs, and then plans are developed. And then there's a website that maps out a lot of the services. That needs to be more robust. And I think there are a lot of organizations coming together, including the Department of Health, to really make that the one stop, if you will, for the provider to help families. And certainly the issues we've been talking about will be a big part of that, whether it's mental health or obesity, smoking. That's all part of that community health improvement plan.
And I'm really glad to hear about the matching of needs assessments to resources, because I feel that one of the things that we haven't talked about yet when it comes to the data is that there are large disparities between racial communities in DC when it comes to infant mortality, and it feels like but a lot of what we've been talking about are maybe those race-sensitive but not necessarily race-specific ways of addressing some of the needs where they are at. And I guess my question to the panel is, really about how do we go, transition from a model where we are putting our strengths and abilities on people, and instead actually enlisting the people that we are serving as partners in the goals that we're trying to reach, so that we're actually empowering them and taking strengths that maybe previously were left unused or undiscovered, and enlisting that help in these goals that we're trying to reach.
Was that a question?
Yeah, I know. It's a bit of a statement and a question. If there are any comments on it, that's great.
I would just start to say, from a public health perspective, that's a core function, is that we are assessing, and that assessment includes what does our community say. It's not, Dr. Lindsay coming into Ward 8. I've never lived in Ward 8 and saying, hey, it looks like you guys need a new school. That might not be the solution. The community members might really think, more than a new school, we think we would really do a lot better off if we had a new playground for us to take our children to. I mean, that's just an example. So it's always very important that the community is part of the solution, because they do have the answers. I don't have all the answers. I have models, and I have theories, and I have studies, but I can't tell a community what's going to be best for it. So I think having the community engaged in these processes of these needs assessments, of these program planning, is integral to the success of these programs and to achieving better health outcomes.
And that's basically been our history here at the Children's Health Center at the ARC, is to respond to the needs of the community and what they're telling us that they desire. We have our mobile health program, and over 14 years ago, when that program started for dental, we were thinking that the community needed a mental health mobile unit. And when we convened our parent advisory group, they said to us that they actually needed dental. And that was how our mobile dental program got started. It was really us having a different assessment of what we thought the community needed, and they came to us and said that mobile dental was what the need was. They had insurance that they could use to access dental services. However, they didn't have a dental provider to be able to go and get the care that they needed. So hence our mobile dental program started. The fact that we have collaborations with other groups to bring services into our clinic was because our families told us that they needed co-located mental health services, psychiatrists in our clinic. We have a grandparent support group here at the ARC because we had grandparents telling us that they needed help in raising their grandkids. They didn't anticipate being the primary caregiver for their grandkids, and this was a change in their life course that they didn't anticipate, and they needed help and services and how to access care to do that. And then our social worker formed our grandparent support group. So I think this is integral in what we've done here at Children's National as far as listening to what the community needs, and then making sure that we respond to it. That's part of our history. That's what we do.
All right. Well, I want to thank Save the Children, Dr. Valsanker, Dr. Newman, Dr. White, and Dr. Lindsay for all of their knowledge and insight. Washington, D.C. may be a tale of two cities, but we can work together for a happy ending. There are good chapters to be written as long as we stay committed to this cause. And, because more than their knowledge and their inspiration, I want to thank these health professionals for their commitment to poor families and children. Regardless of whether it's the best of times or the worst of times, regardless of whether it is the season of light, the season of darkness, the spring of hope, or the winter of despair, doctors and public health professionals are committed to the families and children in our care. And today we are focused on DC, but this tale of two cities is happening in Baltimore, in Ferguson, in New Orleans, and Los Angeles. Now let's get to work on building inspiring stories for all of our children. Thank you. Welcome back to the Dr. America Show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram. So I hope you guys got to enjoy that special clip of us at the Save the Children launch event for their report of the state of the world's mothers. As you can tell, there's a lot of information to get through. A lot of people have done some deep thinking on this. And what I was really proud about with that event was that it wasn't just about raising awareness. They actually did a great job of talking about how they wanted to take their awareness of these problems and actually advance that into action. And I always find that to be the important part of any kind of event like this. And I always find that to be the urgent part of learning something, incredible that, being born in Ward 8 of Washington, D.C. means that you have a 10 times higher risk of dying than a baby born in Ward 3 of Washington, D.C. So, I'm really proud of the panel. I think that they did a fantastic job of inspiring some real action. And, I know that, and we're going to actually go back to the panel in next week's episode because there's actually a really good discussion that happened after these presenters were done. We kind of broke things into a Q&A session, and that actually led to a really interesting conversation about, action items and where, we should be like building our networks of support so we can strengthen this web of mutuality that, all of our kids and families live in. And I'm really proud of that discussion. It's going to be exciting to share with you guys, but we're going to do that next week. For this week, I know that you got to hear a lot of information in that panel that was very, very specific to Washington, D.C. But I want you guys to know that, as much as like that might seem like, that it's just Washington, D.C., I want you to know that that same story, that tale of two cities where you're seeing one half of a city with really strong health outcomes and the other half of a city with really weak health outcomes, that is happening all across America. That could be Baltimore, that could have been Ferguson, that could have been New Orleans, that could have been Los Angeles. I mean, that is happening in cities around this country, and D.C. is really just the tip of the iceberg. So if we're going to really be serious about saying that, Black Lives Matter, Brown Lives Matter, that poor lives matter, then we're going to have these, really tough conversations. And I applaud the panelists for actually venturing into this territory because I think one of the first things that, it is a courageous step to be honest with oneself. And, if I hope you guys could hear it in their presentations, but these are people who have actually done the heavy thinking and they've actually, asked themselves, would I want this for my family? Like, if my family was in these situations where resources were low, where outcomes weren't looking all that great, what would I want for them? And I think the fact that they took it so personally and they bring that to their work is highly commendable. So, I'm really excited that I got to share this with you guys on Mother's Day. So I'm going to go ahead and keep moving on because, I want to make sure that we got to give Dr. Oz his laxative. I mean, it's that time of the program. It's that time of the week, so for those of you who don't know, the reason why we got to give Dr. Oz a laxative is because he obviously has a problem with a whole lot of bullshit. So, when you've got that problem, it helps to move things along. And what I like to do is offer Dr. America's weekly laxative for Dr. Oz. And, this one's actually pretty simple. Dr. Oz, I hope you got to see the show today because to me, that's what real doctors do. You just got to see some real doctors doing some real heavy lifting, having some real tough conversations about some things that are really mattering in the world today with babies and moms. And, I would say that if you really want to earn that seat as vice chair of surgery at Columbia Medical School, you're just a plane ticket away from, visiting some of these parts of the world where, we have got over half of the mothers in the developing world are giving birth without any kind of trained health professional to guide them through the process of giving birth. And, that is a sad fact for the 21st century. And Dr. Oz, you can earn your, surgery credentials, your street cred again by actually, I think, not only going to these parts of the world, but actually sharing your surgical skill, sharing some of your ability with, with some of the local health workers so that they can know how to, bring life into the world without, putting more life at risk. So, Dr. Oz, I'm giving you a really gentle laxative this week because, it's Mother's Day and I don't want to say anything to you that, like, my mom wouldn't like. So there you go. That's your laxative for the week. I think you got off a little bit easy. We'll probably take it a little bit harder on you next time. So, okay, so we covered a lot today. We covered, the state of the world of the world's moms with Save the Children. We got to hear from an amazing panel, and I'm really looking forward to putting up the rest of that broadcast in next week's episode because I want you to hear that discussion, that back and forth between some of the people who had questions and the panelists with some really in-depth answers. And we even squeezed in some time for giving Dr. Oz his laxative, and hopefully he takes some of that advice to heart. So I want to thank you guys so much for joining us on Mother's Day. Please don't forget to call your mom, tell her tell her thank you, tell her I love you, and I think that being a mom in the world today, as you're going to learn from the Save the Children report, it's not easy work, but it is that is love's labor right there. And so thank you to all the moms, and thank you guys for tuning in to Dr. America here on the WEAC Radio Network. I've been your host, Dr. Sanjeev Sriram, and until next week, salud to your health.